It's 3 in the morning. You're wide awake, again. You don't know why. You weren't having a nightmare. You don't need the bathroom. You're not particularly stressed. You just woke up. And now you're lying there in the dark, staring at the ceiling, watching the minutes tick by, knowing that every hour you spend awake is another hour of sleep you're not getting. If this sounds familiar, you are not alone. And more importantly, this is not just a normal part of getting older, no matter how many times you've been told that it is. There is a specific biological reason this is happening to you, and once you understand it, there are concrete, evidence-based steps you can take to stop it. Today, I'm going to explain exactly why so many people over 60 wake up in the middle of the night, what is actually happening inside your brain and body during those wakeful hours, and the 7 specific strategies that sleep medicine specialists use with their own patients to fix this problem. Stay with me, because strategy number 4 is the one almost nobody knows about, and in clinical studies, it has shown some of the most dramatic results of any non-medication sleep intervention ever tested. Before we get into the science, I want to address something important. Most people who experience this pattern have been told one of 2 things by their doctor. Either, this is just aging, learn to live with it, or, here is a prescription for a sleep medication. And while sleep medications absolutely have their place, the research is very clear that they do not address the underlying causes of age-related sleep disruption. They sedate you, which is not the same as restoring healthy, restorative sleep. In fact, a landmark 2019 study published in the British Medical Journal found that long-term use of common sleep medications in adults over 65 was associated with a significantly increased risk of falls, cognitive impairment, and in some cases, accelerated dementia progression. The good news is that the underlying causes of middle-of-the-night waking in seniors are well understood by sleep medicine researchers, and most of them are highly addressable without medication. Let me walk you through what is actually happening. Sleep, as you may know, occurs in cycles. Each full cycle lasts approximately 90 minutes and consists of several distinct stages: light sleep, deep slow-wave sleep, and REM sleep, which is the dreaming stage. In young adults, the first half of the night is dominated by deep, slow-wave sleep, the most physically restorative phase. The second half of the night shifts toward lighter sleep and longer REM periods. After the age of 60, this architecture changes significantly. Deep, slow-wave sleep decreases dramatically, sometimes by as much as 70% compared to younger adults, according to research from Harvard Medical School. The sleep cycle becomes shallower overall, and the transitions between sleep stages become less stable, meaning it takes far less stimulation to pull you fully awake during those transitions. So, when you wake up at 3 a.m., you are almost certainly waking during one of these unstable transition points between sleep stages. The question is, what is triggering that waking? Because there are several specific culprits, and identifying yours is the key to fixing the problem. Sleep medicine researchers have identified 5 primary biological mechanisms that cause middle-of-the-night waking in adults over 60. Understanding these will help you identify which ones apply to your specific situation. Cause number 1, circadian rhythm phase advancement. Your body runs on an internal 24-hour clock, the circadian rhythm, governed primarily by a tiny structure in the brain called the suprachiasmatic nucleus. After 60, this biological clock begins to shift earlier, a phenomenon called circadian phase advancement. Your body starts secreting melatonin earlier in the evening, which is why many seniors feel sleepy by 8 or 9 p.m. But it also reaches its end of the melatonin cycle earlier in the morning, often around 3 or 4 a.m., which is precisely when you wake up. Your body is not malfunctioning. It is simply running on a different clock than it used to. And that clock can be reset, which I will explain shortly. Cause number 2, cortisol dysregulation. Cortisol, the body's primary stress hormone, follows a natural daily rhythm. In healthy sleep, cortisol reaches its lowest point in the first half of the night and then begins rising in the early morning hours to prepare the body for waking. After 60, this cortisol rise often begins too early. triggered in part by changes in the hypothalamic-pituitary-adrenal axis, pulling you out of sleep before your body has completed its full restorative cycle. Chronic stress, elevated blood sugar, and alcohol consumption, even moderate amounts, all amplify this early cortisol surge. A 2021 study published in Sleep Medicine Reviews found cortisol dysregulation to be present in the majority of older adults with chronic middle-of-the-night insomnia. Cause number 3, core body temperature dysregulation. Healthy sleep requires a drop in core body temperature of approximately 1 to 2 degrees Celsius. Your body accomplishes this through a process of peripheral vasodilation. Essentially, blood vessels in your hands and feet dilate, allowing heat to radiate outward. After 60, this thermoregulatory process becomes less efficient, meaning your core body temperature may not drop as deeply or may begin rising again too early in the night, triggering arousal. This is one of the reasons sleeping in a cool room becomes increasingly important as you age. Cause number 4, reduced adenosine sensitivity. Adenosine is a naturally occurring chemical in the brain that accumulates throughout the day, creating what sleep researchers call sleep pressure. The longer you are awake, the more adenosine builds up, and the stronger your drive to sleep becomes. After 60, the brain's sensitivity to adenosine decreases, meaning you accumulate sleep pressure more slowly and respond to it less powerfully. This results in lighter overall sleep and more frequent awakenings throughout the night. Caffeine, as you may know, works by blocking adenosine receptors, which is why even moderate afternoon caffeine consumption has a dramatically stronger effect on sleep disruption in older adults than in younger people. Cause number 5, Nocturia, nighttime urination. This one is the most commonly reported cause of nighttime waking in seniors, and yet it is almost always treated as the primary problem rather than recognized as a symptom of other underlying issues. While some degree of increased nighttime urination is a normal consequence of aging changes in the bladder and kidney function, research published in the journal Neurourology and Urodynamics found that in a significant proportion of older adults, nocturia is actually secondary to sleep disruption rather than its cause. In other words, you are not waking up because you need the bathroom. You are waking up for one of the other reasons on this list, and then noticing you need the bathroom because you are already awake. Addressing the underlying sleep architecture issues frequently reduces nighttime urination without any specific bladder treatment. Now I want to pause there, because I know that was a significant amount of information, and it can feel overwhelming to hear that there are 5 different biological systems contributing to your sleep problems. But here is the important perspective. Every single one of those mechanisms I just described is addressable. None of them requires a prescription. None of them requires expensive equipment or major lifestyle upheaval. What they require is the right strategy, applied consistently. Let me walk you through the 7 strategies that sleep medicine specialists consider most effective for this specific pattern of middle-of-the-night waking in seniors over 60. Strategy number 1. Morning light exposure, within 30 minutes of waking. This is the single most powerful tool available for resetting a shifted circadian rhythm, and it costs nothing. Bright light exposure in the morning, ideally natural sunlight, but a 10,000 lux light therapy lamp works equally well on cloudy days or in winter, directly signals the suprachiasmatic nucleus to anchor your circadian clock to the correct time. A 2020 randomized controlled trial, published in the Journal of Sleep Research, found that seniors who received consistent morning bright light exposure for 4 weeks showed significant improvements in sleep onset, sleep duration, and crucially, middle-of-the-night waking frequency. The timing is critical. The light must be received within the first 30 to 60 minutes after waking to be effective. Sitting by a sunny window with your morning tea or taking a short walk outside immediately after waking are both sufficient. Aim for at least 20 minutes of exposure. Strategy number 2. Keep your bedroom temperature between 16 and 19 degrees Celsius, that is 60 to 66 degrees Fahrenheit. This directly addresses the core body temperature dysregulation we discussed. Research from the National Sleep Foundation confirms that cooler sleeping environments consistently produce deeper, more consolidated sleep in adults over 60. If you share a bed and cannot control the room temperature easily, consider a cooling mattress pad. These are available at a range of price points and have substantial research support for improving sleep quality in seniors. Even a light blanket swap from a heavy duvet to something lighter can make a measurable difference. Strategy number 3. Stop all caffeine by 1 p.m., without exception. Caffeine has a half-life of approximately 5 to 7 hours in most adults, but after 60, caffeine metabolism slows significantly, meaning the effective half-life can extend to 8 or even 10 hours. A cup of coffee at 3 p.m. is still 50% active in your system at 11 p.m. A cup at noon may still be affecting your adenosine receptors at 8 or 9 p.m. A 2023 study in the journal Nutrients found that moving the caffeine cutoff from 4 p.m. to 1 p.m. in adults over 65 produced statistically significant improvements in sleep continuity within just 2 weeks, with no other changes to lifestyle or routine. This is one of the fastest-acting and most underestimated interventions available. Strategy number 4, the one I mentioned at the start that most people have never heard of, sleep restriction therapy. I want to be clear that this strategy requires commitment. It feels counterintuitive, but it is the most evidence-backed non-medication intervention for chronic middle-of-the-night insomnia that exists. It is the core technique of cognitive behavioral therapy for insomnia, known as CBT-I, which is now recommended as the first-line treatment for chronic insomnia by the American College of Physicians, above medication. Here is how it works. Instead of spending 9 or 10 hours in bed trying to get 7 hours of sleep, you temporarily compress your time in bed to match your actual sleep time, typically around 6 to 6.5 hours for most seniors initially. You set a fixed wake time, let's say 6 a.m., and you do not go to bed until 11:30 p.m., regardless of how tired you feel earlier. This deliberately builds adenosine pressure, restoring the sleep drive that has weakened with age. After 1 to 2 weeks of this compression, sleep becomes significantly more consolidated, and the middle-of-the-night wakings decrease dramatically. The time in bed is then gradually extended in 15-minute increments as sleep efficiency improves. A meta-analysis published in Sleep Medicine Reviews found CBT-I to be effective in over 70% of chronic insomnia sufferers, with results that outlast medication effects by months or years. I strongly recommend discussing this approach with your doctor before starting, particularly if you have a medical condition where sleep restriction could be contraindicated. Strategy number 5. Eliminate alcohol completely after 6 p.m. This is one of the most common and most damaging misconceptions in senior sleep health. Many older adults use a glass of wine or a small whiskey before bed as a sleep aid, and it does make falling asleep easier initially. But alcohol is one of the most potent disruptors of sleep architecture known to science. As your body metabolizes alcohol through the night, it triggers a rebound cortisol surge, typically around 3 to 4 hours after consumption, which is almost precisely when most seniors wake up. A 2018 study published in Alcoholism, Clinical and Experimental Research found that even moderate alcohol consumption, defined as 1 to 2 standard drinks, consumed within 3 hours of bedtime, significantly increased nighttime waking in adults over 60, even when it had no measurable effect on sleep onset. If you drink socially in the evening and you wake in the middle of the night, this is almost certainly a significant contributor. Strategy number 6, the 20-minute rule for middle-of-the-night waking. If you do wake in the night and cannot return to sleep within approximately 20 minutes, sleep medicine specialists universally recommend getting out of bed, not to watch television, not to check your phone, both of which expose you to light that will further suppress melatonin. Instead, go to a dimly lit room, sit comfortably, and engage in a genuinely boring, low-stimulation activity, reading a physical book, doing gentle breathing exercises, or simply sitting quietly. Return to bed only when you feel genuinely sleepy. This technique, called stimulus control, works by breaking the psychological association between being in bed and being awake and frustrated. Over time, the bed becomes associated exclusively with sleep, and falling back asleep on returning to it becomes progressively easier. Strategy number 7. A targeted evening nutrition protocol. Specific nutrients have been shown in clinical research to support the neurotransmitter systems involved in sleep initiation and maintenance. 3 in particular have the strongest evidence base for adults over 60. First, magnesium glycinate, at a dose of 200 to 400 milligrams taken 60 to 90 minutes before bed. Magnesium directly activates the GABA receptors involved in sleep initiation and has been shown in a 2021 double-blind placebo-controlled trial to significantly improve sleep efficiency and reduce early morning waking in older adults with low magnesium levels, which affects an estimated 70 to 80% of adults over 65 due to decreased dietary absorption. Second, tart cherry juice. 2 tablespoons of tart cherry juice concentrate diluted in water, consumed in the evening, has been shown in multiple studies to naturally increase melatonin levels and improve sleep duration in older adults, without the dependency risks associated with melatonin supplements. Third, a small high tryptophan snack 90 minutes before bed. Tryptophan is the amino acid precursor to both serotonin and melatonin. Foods high in tryptophan include warm milk, a small handful of walnuts, or a few slices of turkey. Pairing these with a small amount of complex carbohydrate, such as a couple of whole grain crackers, helps facilitate tryptophan's transport across the blood-brain barrier. Before I wrap up with a recap, I want to spend a moment on something important. While the 7 strategies I have shared today are effective for the vast majority of age-related middle-of-the-night waking, there are specific situations where your sleep disruption may have an underlying medical cause that needs professional evaluation. Please speak with your doctor if any of the following apply to you. You or your partner has noticed that you stop breathing, gasp, or snore heavily during sleep. This may indicate sleep apnea, which is both common and serious in older adults and requires specific treatment. If you experience uncomfortable sensations in your legs at night, a creeping, crawling, or irresistible urge to move them, this may be restless leg syndrome, which is highly treatable. If your sleep disruption is accompanied by significant mood changes, persistent low energy, or loss of interest in activities, this warrants a conversation with your doctor about whether depression or another condition may be a contributing factor. And if you are currently taking any medications, including blood pressure medications, antidepressants, diuretics, or corticosteroids, ask your prescribing physician whether your medications could be contributing to sleep disruption, as this is extremely common and very often overlooked. Everything shared in today's video is based on published peer-reviewed research from institutions including Harvard Medical School, the American College of Physicians, and sources including the journals Sleep Medicine Reviews, the Journal of Sleep Research, and Alcoholism, Clinical and Experimental Research. All key references are linked in the description below. This content is for educational purposes only. It is not medical advice and is not a substitute for a consultation with your doctor or a qualified sleep medicine specialist. Individual health circumstances vary significantly, and some of the strategies discussed, particularly sleep restriction therapy and nutritional supplementation, should be discussed with your healthcare provider before implementation, especially if you have existing medical conditions or take regular medications. Let me bring everything together. Tonight, if you wake up at 3 a.m., I want you to remember 3 things. First, it is not your fault, and it is not simply aging. There are specific biological reasons it is happening, and they are addressable. Second, the most powerful thing you can do tomorrow morning costs nothing. Get outside within 30 minutes of waking and expose yourself to natural light for at least 20 minutes. That single habit, done consistently, can begin shifting your circadian rhythm within 2 weeks. And third, if you are drinking alcohol in the evenings, eliminating it after 6 p.m. may produce results faster than any other single change on this list. The full 7-strategy approach we covered today: morning light exposure, cool bedroom temperature between 16 and 19 degrees, caffeine cutoff at 1 p.m., sleep restriction therapy, no alcohol after 6 p.m., the 20-minute rule for middle-of-the-night waking, and an evening nutrition protocol, including magnesium glycinate, tart cherry juice, and a tryptophan-rich snack. Implement even 3 or 4 of these consistently for 2 to 3 weeks, and the research strongly suggests you will see meaningful improvement. If this video helped you today, please subscribe to Vital Years. Every week I publish new, research-backed content specifically for people over 60, covering the health topics that matter most to your quality of life, your independence, and your longevity. No generic advice, just the science, explained clearly and honestly. Next week, we are going to tackle one of the most important and most misunderstood topics in senior nutrition: the 5 foods that research shows can slash your diabetes risk by up to 40%, even if you are already pre-diabetic. That video goes live next week. Make sure you are subscribed so you don't miss it. Sleep well tonight. You deserve it.